I'd like to introduce myself. My name is, or I should actually say, Mike Nia Precious Collins. Mike Dekoven, friends, welcome everyone to today's session here, Amplifying Tribal Indigenous Voices on Substance Use here in Colorado. My name is Precious Collins. My pronouns are she, her, hers. I am a Ute Mountain Ute tribal member from Southwest Colorado. And I am actually in dual roles. I am pursuing my master's in public health with CU Anschutz, as well as I am with Colorado Providers Association as a certification manager, overseeing and managing both the peer and family specialist credential as well as the prevention credential for the state of Colorado. With that, I want to quickly do a land acknowledgement. I think it's important that we acknowledge the land and space that we take up today in the state of Colorado. So with that, it's important to recognize and acknowledge and respect those who came before us, those who resided on this land before the expansion of the Western world, and to also acknowledge that colonial genocide and oppression still exists. We all need to work together to do our best for the survival of this world, this land, the animals, the environment, and for mankind. As I present these words to you, I would like you to know that they aren't just words that are made up of sounds and letters. To us, when they're spoken in our indigenous languages, they mean a much deeper connection and can be heard and felt beyond what human ears or existence can comprehend. In many indigenous groups, the language we speak was given to us by our Creator and by our brothers and sisters that walk with us on this earth. Please respect our use of indigenous language and culture and ceremonies for these purposes. This land acknowledgement will hopefully remind us all, and those of you working with indigenous communities and people, that non-dominant groups need our support. Acknowledging that indigenous people have suffered from injustices and broken treaties which have left us with health disparities, broken promises, limited healing resources, and access to land. We see this in high rates of alcoholism, substance use, and suicide. By acknowledging this and making a commitment to make changes and address social determinants of health at all levels is important for not only the future of our indigenous people who call this land home, but to all mankind. With that said, I'd like to acknowledge all the 48 plus tribes, including my own ancestors from the Nooch band of the Ute people, and those that call this land ancestral, ceremonial, and spiritual ties, and everyone from indigenous peoples south, into Mexico and north. I'd like to acknowledge their presence here today. And through many treaties and forceful removal, our indigenous people were removed to ever-shrinking reservations or became urban or were put into urban situations. We want to acknowledge today that this present time, indigenous people have learned to adapt, and still we suffer from these disparities and post-traumatic stress that cripples our ability to reconnect with our indigenous language and cultures, as well as our traditions. I pray to the Creator today that we can continue the work together, build relationships, and change the world for the better. So with that, I want to hand it over and actually introduce the two speakers here to my left. They are today's panelists, and I'll go ahead and give that over to them to introduce themselves. Imo, if you want to go first.
Can you hear me? Okay. Ja, tohi leaning shlon torich ini bashishin. Zlatni dashichedo na kaiden edashnala stanchli. So, hello. I am of the Water Flows Together clan, born for the Bitterwater clan. My maternal grandfather's clan is Mountain Cove, and my paternal grandfather's clan is Mexican clan. That's how I identify myself as a Navajo woman. So my name is Imo Sacco, and I am a director for Indigenous Wobriety, which I created and modeled after a program I built in grad school. I earned my MSW with the University of Denver, I am a first language speaker with the Navajo Nation and born and raised on the Navajo Reservation. I currently reside in Cortez, Colorado, and that's it.
Thank you, Imo. Stephanie?
My name is my name is Stephanie Salazar Rodriguez, and I am the owner and lead trainer of Blazing Cloud Consulting. We are a small minority woman-owned business. We specialize in training and technical assistance to address emerging public health issues, authentic community engagement, youth violence prevention, and special events. All of our work is rooted in justice, equity, diversity, and inclusion. I am a descendant of the Taos Pueblos and of the Apaches, but my family left the reservation in the early 1900s, so I am a second-generation indigenous person that was raised in an urban area. I possess a master's of public health and a master's of nonprofit, and over 30 years experience as a trusted community leader, community connector, and social justice advocate.
Awesome, thank you. Yes, round of applause for our guest speakers today. So with that, I'm gonna go ahead and jump into some questions here, and Stephanie, we'll start with you. How do you see substance use issues manifest directly in your prospective area that you serve?
Well, like any other community, we are facing this, and many of the people that we are working with are utilizing more than one substance. It may be alcohol, it may be cannabis, or it may be something else. So we see it in many ways. We have individuals who have suffered and have experienced the historical and trauma, and so many of them have been through colonization, through being stripped away from their families, taken from the reservations, put in boarding schools, and they have one of the themes in the boarding schools were to kill the Indian to save the man. So today actually is Orange Shirt Day, and that is acknowledging all of the children who were sent to boarding school, and many of them did not return. So that's why we're kind of wearing our colors today in honor of that. So we see it manifesting itself in many ways, and there are many things that I think people really need to take into consideration when dealing with these populations of what they have been through in the time since colonization.
Thank you, Stephanie. Imo?
I forgot to say what I do real quick. So I direct a nonprofit organization, all Native American led. We are focusing on peer recovery services using Wellbriety, which is a Native American evidence-based treatment modality in supporting people who are struggling with substance use and or trauma and mental health disorders. What was the question again? I'm sorry.
So how do you see the substance use issues manifest directly in your prospective area?
It's been interesting. I think for the most part, substance use, especially alcohol addiction, has been a huge, huge issue and obstacle in our Native American populations. And it's nationwide. It's not so much just in Cortez, and it's beyond Colorado. And I've, in my previous work, working in public safety as a dispatcher for 10 years, I feel like most of the issues stem from the generational trauma and learning how to cope with our trauma, our childhood traumas, our mental health disorders, and that we also felt like we normalized alcohol addiction. And it's common for us to experience some sort of alcohol addiction, whether it's in ourselves or within our family members or someone that we love.
Thank you, Imo. Next question, as we talk about amplifying tribal and indigenous voices, how have you seen Native American perspectives and considerations overlooked in the services that you provide or in Colorado in general? Stephanie, or Imo, if you want to take this one.
Sure. That was probably the reason why I started Indigenous Wellbriety. It was, I left the reservation, moved into Durango, Colorado, pursuing my degrees, and in my journey, I was working in mental health outpatient for my internship as a case manager and intern therapist. And like I said earlier, I'm first language, but I'm also a lot of culturally deeply rooted values in my upbringing. And seeing that, knowing that in my background, and also seeing the clinical perspective in treatment with substance use and mental health disorders, it really made me eek. And hearing voices, Native American voices, in their journey and how they're trying to access some treatment for their addictions, it's really interesting to see that dynamic as someone who's lived on the reservation most of their lives, and then dealing with also alcohol, and then seeing, you know, that shift from the reservation to Southwest Colorado, and accessing treatment is something that was really needed, but also being able to be a person of color and Native American working for a predominantly non-Native agency was something that was really making me feel uncomfortable. And I guess it's hard to say, you know, self-stigma really does stick to people like us, knowing that we're Native and experiencing discrimination going to border towns growing up. It always affects us in how we perceive ourselves as Native people in a professional setting, especially in a non-Native professional setting, and being able to align that self-stigma and behavior, and then trying to figure out the clinical approach with the Western education approach, it's really difficult. And so throughout my journey, I felt like, you know, this is something, as I found out about Wellbriety, it's evidence-based, and it's Native American-led, and it's owned by White Bison Incorporated out of Colorado Springs. And I was like, this is already done. The work is already done for us. We, you know, it's for somebody who wants to implement it, great, but how do we do it? And so I modeled it after the grad school program that I built and combined it. Originally, I had thought of launching a Native American Resource Center, but the same approach. It all has to embody people with lived experience, people who identify as indigenous, and I'm not gonna ask for a CIB also, which is a Certificate of Indian Blood. I don't ask for that. I feel like that's very intrusive. And so for the most part, combining a lot of my cultural upbringings, my education, and my work experience really allowed me to, you know, launch this. But not only that, meeting the right people in, you know, in a setting where I thought nobody would really support me. It's really important. And non-Native people really believed in me and said, you can do this. And I come from a place where I've been put down and told, you cannot do this. And there's always a rule, there's always a law, there's always a lot of patriarchy involved in the, you know, tribal government systems, along with other, you know, nepotism and political issues, just like everywhere else when we work for a government entity. And it was really difficult, you know, for me to challenge myself and also who I am as a Native woman, and to be able to say, yes, I can do this. And there's mentors out there that will really allow you to bring the best of you out and say, you can do this. You are enough, you're educated enough, you're smart, you're intelligent, you're great. And you know, amplifying indigenous voices is important. It's not just about being indigenous, it's about making us feel comfortable in spaces that we usually don't. And you're probably like, how do I know that? And it's just being genuine. Being very genuine with us, because we can feel that. We have a spidey sense about it. And I think that's the most part, is being genuine and being open with us and allowing us to be ourselves in a profession where it's really hard to, you know, convince people that our culture is our who we are. Our culture is important to us. And that's it. Sorry.
Thank you, Imo. Stephanie?
In the work that we're doing in an urban setting, we are still seeing many struggles of the voices of indigenous people being amplified. We know that there is still very much institutional and structural racism, and many times the institutions may be making an effort, but the racism is so ingrained that many people are unaware, and it falls into the category of implicit bias. For us, there's very little funding to do this work in the urban Indian communities. I was elated to hear the Attorney General talk about giving $2 million to the tribes today, which is wonderful. But, you know, the work that we are doing as a small organization, the only other people that we know that are doing this work is Denver Indian Center, Denver Indian Health, I'm sorry, and also earlier Precious informed me some of the work that Denver Health is also doing. But we really feel that there needs to be some additional funding to be able to have this work not only in Denver, because we are funded by the Denver Department of Public Health and Environment, but our work is exclusive to the city of Denver. So we have our relatives that live to the west of us in Jefferson County, and our relatives that live to the east of us in Adams County, our relatives that live to the north of us, and our relatives that live to the south, and we cannot do this work in any of those communities. So there is not enough funding out there. So to me, one of the most important things to this work is, in order to amplify voices, you have to have funding in these communities to be able to do this work. So I think that's the greatest challenge that we have had in amplifying the voices, the voices of the indigenous people in our communities.
Thank you, Stephanie, and I'm glad you brought that up. You know, stigma is a big part of access to care and access to treatment and access to recovery, access to a lot of services and tools that could benefit indigenous people's health and well-being. So with that said, what are some of the strategies you've found effective in reducing that kind of stigma, especially working in urban settings?
Well, first and foremost, I want to say that it's extremely challenging, but I want to give you an example of something that we have experienced ourselves. My father, who is now deceased, had a congestive heart failure, and at one time we took him to a local hospital in the emergency room, and he was in the midst of having a heart attack, and this young doctor came in who happened to be a young white woman, and she said to him, "When did you have your last drink? It's obvious that you're going through the DTs." So just the stigma of looking the way that he looked, and he had long hair and he had braids, and he wore a bandana, and so just those things that happen. I mean, this has happened to us on many, many occasions. So just even looking the way that you look, that you don't mean mainstream society's looks, is a barrier, and that starts the stigma. So we see it so many times, and especially of our people who are struggling. We work with several people who are doing street outreach, and they don't even want to come into any of these organizations because, first and foremost, there is nobody that looks like them, nobody that speaks like them, and so they don't even want to try to get that. We work with many of the elders when we're doing Narcan distribution, and we have employed a method to help them, because when we first started doing this, they were very embarrassed, and the stigma related to having Narcan. So we now have these branded bags, and we put the Narcan in them. We also put other types of swag, so nobody knows what's inside of them, of the bags. And so we have people who come up to us, and they may say quietly to us if they can get some Narcan, and so we already have it pre-bagged. And so just the stigma of even looking the way that we look, and we know that there's not culturally responsive services. There's not culturally responsive, very few to linkages to care, and very few in mental health, and especially in recovery. So we challenge that all the time. Some of our funding comes from the CDC, and they want us to only provide evidence-based services versus best practice or culturally sensitive, and there just are not a lot of those services out there. So when people try to access those services, just being who they are is a significant issue, and trying to reduce that stigma of getting funding from these organizations to provide those culturally relevant services is really, really challenging for us.
Thank you, Stephanie. I would like to add, over the summer I worked with CU Anschutz on a project, and they were contracted with BHA on ethical considerations modules for underserved populations. If you're interested in knowing more about that, contact me. I apologize, we didn't get our contact information on this slide, but afterwards you can come and find me. I can give you my email. But in those modules, it hasn't gone live yet from my understanding, but in those modules, provider education is key in understanding culturally how to meet the needs of indigenous not just indigenous populations, but other underserved populations such as LGBTQ+, veterans, those experiencing homelessness or unhoused people. There is a huge gap there, and BHA contracted with the university to try to fill that with education for providers, because my aunt had an experience like that. A person who in Southwest Colorado is from North Dakota but came home for ceremonies, for our summer ceremonies, spring ceremonies. She has cancer and had and is also diabetic and had a diabetic episode, went to the hospital there in Cortez, and the physician, the doctor, asked my brother, who had just turned 18, how many drinks of alcohol a day she drinks. And he was so taken back by it. He was like, what do you mean she doesn't drink alcohol? And was grilling him so hard. You would think that it was a crime to drink alcohol, but you know, to the point where he called me and said, hey, can you talk to the doctor? Because they're not believing me. And they finally got her medical records from North Dakota proving that she had cancer. And she has cancer in her, pretty much her whole lungs, liver, and other places, everything, yes. And so it's starting to metastasize, yes. And that was the experience, and I thought, wow, we need to do more work. Definitely need to do more work. So with that, you know, keeping in mind in the programs and services you work with providers, please help them, educate them, and encourage them to get educated about working culturally with people, especially underserved populations. So outside of stigma, IMO, what are some unique challenges that Native Americans face specifically in your community in accessing treatment and recovery services?
Yeah, so I think one of the biggest things is having people on staff in healthcare, behavioral health areas that are coming from diverse backgrounds. I think that is one of the biggest hindrances and barriers in trying to serve not only our indigenous people, but our people of color. There are studies out there that prove that a person of color will be more comfortable around someone who identifies with them based on where they're coming from by their provider. And, you know, that whole setting and meeting the person that you're dealing with is really important. And I always say that it's really important to put on a social worker lens when you're working with people of color and indigenous people. I feel like I can never, you know, share that being genuine, being your whole self around somebody who is struggling will really set the tone for how your whole session will take place. And that's important. And the other thing is just the transportation in Southwest Colorado. I know it's probably like that in other rural Colorado areas, but as a mother of someone who struggles with mental health disorders, it's really hard for at least my daughter to receive transportation right away to Front Range because she has psychotic symptoms. So it's really important that she has that high level of care when she does have her episode, and that's not available right there in Cortez or even Durango. And so that's one of the biggest barriers, and also someone who's needing inpatient treatment for their addiction and detox. It's far. You have to call all these Medicaid supported transportations, and it takes a while for them to get to Cortez or Durango and then transport. So that's a huge piece. And the nearest facilities that need that high level of attention are all in either Grand Junction or Pueblo or Colorado Springs or Denver. So, and that's 7-8 hours away from, I drove 10 hours last night because of traffic, but when I come to Denver, it usually takes me about 7 to 8 hours. And, you know, that's a far cry for, you know, the services that you need. And even going to Grand Junction is like 4 hours. And so those are some of the biggest important pieces to always remember. And a lot of our rural patients are getting their care in the Front Range. So that's also an important factor to put in your mind when someone has traveled so far just to, get the attention they need from you. And so I think that's always good to remember.
Thank you, IMO. And for those of you who aren't familiar with Cortez, where IMO is primarily you're working from, right? In order to get up here to the Front Range, you gotta go over a pass, and multiple passes sometimes. And so the geographical location of these services is definitely can be a barrier for indigenous people. Thank you, IMO. Stephanie, are there any key significant challenges that you see in your community?
I think the biggest one is, in general, we are all experiencing a lack of behavioral health providers, especially those that can offer culturally relevant and culturally responsive services. So we know that, inpatient services, especially those that, accept only commercial insurance, is very challenging. So we have people who are Medicaid, Medicare, and really don't have those services. We also see people coming that are in Denver that are coming from North Dakota, from Pine Ridge, that are going all the way back to the reservation for services because they're not there. And the services, the behavioral health services that we have in Denver, primarily just through Denver Indian Health Services, are, there to provide basically short-term. There's no long-term care there. And they're doing a wonderful job with the resources that they have, but there just is not ample. Right now, they are, building another facility, and they just started doing, have a mobile van, and so they're doing some of that, but there's just not enough service providers anywhere, I think, across the state, and maybe it's even an issue nationally.
Awesome, thank you, Stephanie. Just so I know you guys are looking at the questions, I'm going to skip number 5. I'm going to go into number 6. How do you think that Colorado opioid settlement funds should be directed to address some of these unique needs that you all are talking about in your perspective areas?
I guess I'll go. I think one of the biggest things that I mentioned earlier was, recruiting and hiring from people of color, indigenous backgrounds, to really be, more. I hear a lot of people that are involved in different initiatives throughout the country, but I never really hear about the state of Colorado, specifically with the opioid initiative. That we need more diverse. We need to employ people from diverse backgrounds. We need to fill the gaps in services, because that's what it is. The gaps in services are these culturally relevant approaches to care for our indigenous people and our people of color. It's very important to see someone like me who's got a PhD in anything, and to be able to say that what you have is what you're dealing with, and I understand it because I know where you're coming from. And so that's really important for us to see that other people that look like us need to be out there also, and to recruit our Native youth, our Native elders, to work together and build into programming, into organizing. Look at it, your local, I know the best advantage of Denver is the Denver Indian Health Center, the Indian Center, and so many Native-led organizations in Denver. I just wish we had that throughout the state. That would be amazing to see, and I see a lot more opportunities when you're trying to focus on what's really the problem and address it, but also looking at that family approach. I think person-centered is great. I see that everywhere. And I see the big old, woo-ha on integrated health, but I've worked for an integrated health outpatient setting, and it still was very person-centered. And so when I run the organization that I am now, we're focused on family. We provide talking circles for our adults, and we provide family-friendly activities. And in that process, we invite the children to the parents with these family-friendly activities. And we invite families to build that relationship and mend the relationship that might be broken, that might have been tainted, because of our generational traumas that we have. And so rebuilding these relationships as someone with an addiction, as someone who has mental health disorders, it's not easy, but to approach it with a family-centered approach, I think is the best way. And it's so interesting how you see that dynamic shift from someone who's not able to connect with their child, but then you provide a beating art night or a beating night or an art night, some sort of fun activity, but also build into meditation and communication, and it's set, and I've seen it happen, and that means more to me. And so because of that need to focus on family, we are also now expanding into youth programming, where I will be hiring 2 peer coaches for youth, and being able to do that in a school setting with one of the only other local alternative school in Cortez, which is Southwest Open School. They allow us to bring 2 peer coaches and do talking circles with our youth, and also provide that support that our youth need. And that's what Wellbriety also really emphasizes on, is that need to build some sort of support for our youth, because that's where it starts, in our childhood, to be able to focus on our behavioral health and our cultural identity. Who are we as indigenous youth? That's also important. As a first language speaker and, exposed to my culture at a young age, I always thought I was all Navajo all the time, and everybody spoke Navajo around me, and that was my world. That's all I knew for the first 10 years of my life, until I started going to border towns. I started learning of different colored people. So I think for the most part, just being able to say that we do care about you and your family, what's going on with you and your child, your sister, your brother, all of that, it means so much to build onto a family-centered approach. Thank you.
Thank you, Imo. Stephanie?
I've mentioned this already, which I really believe that there should be an equitable system to fund indigenous programs that are run that they serve, that the staff mirrors the community that they serve, because that will allow them to then have the culturally responsive services. But like Imo had stated, it's really important to make sure that the whole family is involved. Recently, we had our first harm reduction indigenous healing event, and we had stuff for, from children all the way to elders. And we had funding from our primary funder, but it was not enough funding to really do the things that we wanted to do. So luckily, because of the work that I do in other communities, I was able to get 2 other sponsors for the event, so we were able to have ample funds. So we were even able to pay 3 of the indigenous organizations that serve Native Americans a stipend for being at the event. We were able to pay dancers and drummers and healers and have an amazing meal. And so this is something that is very unusual. So I really believe that it needs to start with funding, and to have our voices at the table of making those decisions when people are deciding where those funds are going to go. And so far, that has not been the case.
Yeah, I have to agree with you. CDPHE just did their listening tour for prevention, and that was kind of echoed through there, is not just with indigenous people, but from a lot of communities throughout Colorado, is the restrictions on how to use the funds, right? And when you're working with indigenous communities, that is super important, because we're not just strictly, our people are not built or rooted in that type of system as far as programming. Our culture is the foundation of our programming, and culturally, for you people especially, and I'm pretty sure the 2 panelists up here will agree with me that food and supplying these things to our community for them to be involved in what we're trying to do is important. And sometimes that $3 restricted per person or whatever that rate is doesn't work. It doesn't work. And so then we have to collaborate with that pressure goes to other programs to take on that responsibility, and that's not fun. It's not fun. And so it can restrict collaboration sometimes on a broader perspective. And so I just want to throw that out there. I know that you mentioned, Stephanie, the cultural approaches. Are there any cultural approaches that you take with Rob Riety down in Southwest Colorado?
Yeah, we do. I actually have an elder on staff. He is, he provides all our healing ceremonies and our prayers that sometimes our participants need. Like, I'm really feeling out of it, like I need a prayer. And at one point, we went to a participant's house and he did a full-on prayer ceremony for her. And that was something that was really needed just to fulfill that one spiritual connection that was missing within their journey. And so that's an example. Another is one of the biggest things that really grew was our back to school blessings. So we have a back to school blessing including food. And this year was our biggest one. We had it catered, and we have school supplies for the kids that come with their families to this event. And what our healer does is put all the kids on one side, and this isn't like a big atrium at the Cortez Cultural Center, and so it's in a circular setting also, and the kids are put on the left side, and the adults and parents are put on the right, and he provides that blessing, and when he's done with it, he has them all smudge themselves in line, and that was one of the biggest things to see as someone who grew up with their cultural upbringing with ceremony, was to see that little child, that little 1-year-old bless themselves. That was like the best thing I've ever seen in my life. And to like a 95-year-old lady coming, doing the same thing and talking about how it's important for our kids to be going to school. And, you know, those are the voices from 1-year babies to elders. It's really important to encompass all of that in these spaces and make sure that ceremony and elders and teachings and language, they're all promoted, because that's who we are. We lose all of that, we're lost. We don't know who we are, because that's what really I struggled with as a teen. As a teen, I became a teen mom. I struggled with a lot of alcohol addiction in my teens, and became a mom at 17, and I've been through a lot. I could tell you so much, but that's going to take a long time. But for the most part, I do it because I see the little girls in me, in all these kids. I see my grandma and a lot of these elders, my grandpa and a lot of these elders, and it gives me a chance to, I guess, fill in that part that I had missing in my life, but also fulfill it for others that have it missing in theirs. And so I think that cultural approach is very important.
Thank you, Imo. With that said, we're going to go to question number 11. Before I ask the question, I want to see a raise of hands. Are there any organizations or people, programs here that work directly or provide some sort of service to Native American people? Okay, thank you. Question to the panelists here. Looking forward, what do you believe are the most important next steps for Colorado communities and organizations to work with Native Americans on addressing substance use, whether that's around alcohol or opioids or other substances, and how to leverage the settlement funds in Colorado to have a lasting impact? Stephanie?
You know, this is a really amazing question. I actually talked to the Attorney General earlier today, and he gave me a little bit of direction on kind of the next steps. But for me, I think the most important thing is to make sure that you have the indigenous voices at the table. When I said that a little bit earlier, when making decisions about where the funding should go. I mean, this will include, you can have listening sessions, you can have focus groups, you can, you know, work with the organizations that are serving these people, but to make sure that they are at the table, they have the knowledge, the wisdom, the understanding of what the people have been through. You know, I believe that is imperative, you know, for us in moving forward, that, you know, these funds are adequately dispersed throughout the state with all of the groups and including the indigenous people. And so I think that this will allow us, the people who have the organizations that are run by the indigenous people, to be able to implement the culturally relevant and responsive services. So I think please not to forget to have those voices at the table.
Thank you, Stephanie. Imo?
Yeah, so I think building relationships is very huge. Whether you're building relationships with other Native community members or non-Native community members. As a person who came to the work that I'm doing now, I didn't just come to Durango, go to work, and then I started this work. It was really the trail that I went on that was not, I didn't think I would be doing this for one. I never thought I did, but when I went to grad school, my intention was to become a therapist, and that's the opposite of what I want to do now. And now I write grants for our organization. I advocate for a lot of the people that need the help that is not being addressed. And me being a single parent for 14 years has made me an expert on budgeting, on figuring out how to get by on little and to nothing. And, to be able to put that into nonprofit work is, I don't know how I did it, but I did apply for the grant with the Colorado Opioid Abatement, and we were allowed to $140,000, and I never thought I would get that. I don't have a lot of grant writing experience, and like I said, I just have a master's in social work, but it was my passion for what I want and what I see for our community, but it's also, I love to write. I'm a creative writer. I'm not a professional creative writer, but it's just something that I've always, embodied growing up. And for the most part, it's being able to, the relationship building is huge. Building those connections. It doesn't matter who they are, where they're coming from. I walked in this morning and I already knew a lot of people, and I'm not bragging about it, but it's just like, have those conversations. Be that voice, or allow our Native people to, speak and give them that space to voice themselves. It doesn't matter how much education or little education they've received. I think their lived experience as a Native person is the most important, and hearing that is important.
Awesome. Thank you so much, Imo, sorry. We're just talking about this. My mom's name was Imogene, and I just keep... So I want to call Kathy up here. Kathy has a special poem that she would like to share with you all.
Kathy's a member of my team. She's also a therapist specializing in substance use and domestic violence.
I wrote this poem about 30 years ago to my dad, because my dad, the struggles we share about the way he looked, and it was always about when he first got here to Colorado, and of course they cut his hair and changed his name, and they named him Daniel, because he had to have a biblical name because that's what they wanted at the time. And as I went on in life, I discovered that we were always taught, well, you just need to assimilate. You'll have less problems. Just assimilate. Assimilate to the primary culture, what was the white culture. Just assimilate. You'll just be fine. And my dad struggled with that, so of course I struggled with that. So I wrote this poem. My dad named me Warrior Woman. Why? Because he said, damn girl, you're going to be fighting with everybody the rest of your life, aren't you? Tired of fighting, but I'm still here fighting.
Kathy, if you want, you can use this one instead, since you're holding. Yeah.
Oh, okay. I didn't realize I was going to hold it either. So the poem is called Tears of My Father. State to state, city to city, job to job. It's Friday. It's payday. There's one restaurant in town. 5 small children running in the shadows of their father's long flowing hair. Suddenly, he stops. There's a sign in the door. No dogs, no Mexicans, and no Indians allowed. His face grows pale as he reads the sign. No dogs, no Mexicans, and no Indians allowed. Tears swell up in his eyes as he looks at his children. Daddy, what's wrong? Daddy, I'm hungry. Daddy, let's go in. Daddy, I'm scared. Daddy, why are you crying? He guides his children to the alley behind the restaurant, and he pulls out his knife, and with one angry swish, he cuts off his hair. Today, I will become an American, so my children can be fed. I pray to my grandfather, please protect my children so they will never have to endure the pain of racism. No dogs, no Mexicans, no Indians allowed.
If I can, if you all can bear with me, in my culture, when we have elders and they come up and they speak, we ask everyone to give them a standing ovation. So if you can, I would love it if you would. Thank you so much, Kathy. Appreciate it. It's the way up. Yep. Thank you all. I appreciate that. Our elders are held in great significance in our community and our culture. And I am so happy that we have Kathy here and bless us here with her poem and her experience. With that, I want to say thank you all for joining us today, for engaging in this important conversation, especially for the panelists here, and amplifying tribal indigenous voices in addressing substance use, which has plagued our generations and continues to plague our generations. We have heard powerful insights and perspectives and to the unique challenges that we still face here in Colorado as indigenous people. From structural racism, historical trauma, and ongoing battles with stigma and poverty, access to cultural competent services and treatment and care, our panelists have shown us that resilience and community-driven solutions and culturally grounded approaches are key in making the difference in our indigenous communities, correct? Yes? Echoing Dr. Brooks this morning, why do we do this the way we do this? Wasn't word for word, she said something like that. As we move forward, it's important that we continue to elevate these voices and ensure indigenous communities have equitable, keyword equitable, access to the resources they may need. We must recognize the strength and wisdom within these communities to work together to break down systematic barriers. Now is the time to make meaningful action, whether you are in policy, whether you're in healthcare, or in advocacy. I urge you to leverage your platform, your voices, and resources to support and empower indigenous-led initiatives as these ladies have here, and to raise and empower these strategies that address substance use and mental health challenges in a culturally respective way that impacts us all. Thank you all today, and I'd like to give a round of applause to our panelists here, Amo and Stephanie. Thank you all.